of their day. And as promised, we'll be talking about oral hygiene. And for this particular discussion, we have been joined by an expert. He is Dr. Raphael Onsongo. He's a dentist and resident in oral and maxillofacial surgery. He'll tell us what that is, right?
Yeah,
Yeah, karibu sana.
Asante sana.
Glad to have you with us.
Asante. I'm
Okay.
glad to be here. Yes, as I said, my name is Onsongo, Raphael Nyamisoa. I'm a dentist, and then I also further specialized in oral and maxillofacial surgery, which is an area specialization in dentistry, which focuses on treatment of congenital malformations, which are like birth defects that affect the head and neck, as well as cancer, like tongue cancer, jaw cancers, and a spectrum of other issues like trauma. If you fall down and maybe you are in a motorbike and maybe you didn't have a helmet, then you get fractures of the jaws and fractures of the face, then we can be able to do some reconstructive work. So yeah, that's what oral and maxillofacial surgery is about, as well as oral diseases like tumors and other issues that may occur in the oral cavity. And,
Okay,
the neck.
interesting. So when we talk about oral hygiene, what exactly do we mean?
So I think oral hygiene, I think it's something that can be simple but can also be complicated depending on how you want to look at it. But let's make it simple. Simply, we'd say oral hygiene is how best we can take care of the things in our mouth, the oral structures. That's the teeth, the tongue, the gums, and the bones that hold the teeth. And so that in essence is what oral hygiene is about, how best we can keep our oral structures in optimal health and in good condition so that they can be able to serve us for long.
Okay,
Yeah.
great. Because early in the morning with my co-host, we're talking about a condition that causes bad breath, and some people really struggle with that and can't understand why. Yet there are people who do not even brush their teeth, yet they do not have bad breath. So what exactly is the problem?
So the condition that you're referring to as having bad breath is the term is halitosis, and so it's caused by a number of factors. Usually, it could be one. Sometimes it could be diet. It could be something that you've eaten. Sometimes there's some people who, once they eat something, especially like garlic, you notice they have garlicky breath. You know, same concept they use when you have like bad breath, and they tell you to chew like gum with mint. So to a certain extent, what you eat can affect your odor. But then it becomes halitosis when it's like chronic bad breath, like for a long time it persists. So it's not regardless of what diet you're on, you still have chronic bad breath. Then it becomes halitosis. And some of the causes could be either you have gum disease, you have periodontal disease where you have lots of plaque, you're not cleaning very well, and calculus accumulations on your teeth. The other thing that could be causing it would be you have cavities in your mouth, okay, and these cavities are accumulating food, and then you're also maybe dexterity in terms of cleaning is not quite good, and there's possibility that now some food debris, plaque and debris remains there, and then it starts producing a foul smell. Another thing that could cause it could also be coming from the back of your mouth, the oral and esopharynx where they communicate. It could be having tonsil stones sometimes also at the back, and the adenoids also. It's possible if you're having an infection or you're having tonsil stones, that they could also equally contribute to bad breath. So it's management. If it's of dental origin, if it's fillings, you can go get fillings done, and you can also have your teeth cleaned. It's called full mouth scaling and prophylaxis, and also maintain good oral hygiene. That also helps to keep bad breath away. You can also use a mouthwash after you've brushed. That should be able to help. If it's coming from the back, you should be able to see an ENT, ear, nose, and throat doctor, who can be able to remove your tonsils, tonsillectomy, if it's chronically infected and producing stones quite frequently. Then there's also the aspect of, it's called, it could be also psychological. There are people who have come who believe that they have bad breath.
Really?
Yes, yes.
Like you do have bad breath,
they don't have bad breath,
believe.
but they feel like they have bad breath. So it could be a psychological, there could be there's a psychological aspect to it, and so that also requires management. So sometimes maybe at some point in the past you had bad breath and people sort of mistreated you, and you're a bit aware. You know, it's like a trauma reaction. So you always think that your breath is stinking, whereas the converse is true. And so there's a psychological aspect to it, which also requires patients to be managed.
Ah, okay. Yeah. That's actually interesting, because you know, it actually speaks of a trauma that someone went through because of bad breath. So it actually caused some sort of a trauma that you grow with over time, and it just sticks with you, and that needs some sort of a therapy for you to overcome that, right?
Yeah, yeah.
Wonderful. And you've also spoken about tonsillitis. I think many people have tonsils, you know, and is it everyone who has tonsils that would have bad breath at some point because of the stones, or is it some cases of people who have tonsils? And for those that do not opt to remove them, because I understand for tonsils you can stay with them or you can remove them. So does it mean that for as long as you have tonsils, you will have bad breath?
Not necessarily. So it is in the case of some people, and there are many other factors also, maybe in terms of their hygiene, etc., and diet. But for others, when they produce these tonsil stones, it comes with a smell. And so it's not everybody who requires their tonsils to be removed. There's usually, we call it like, there's some thinking, some justification towards having your tonsils removed. Not really particularly a specialist in that particular area, but generally if you have recurrent infections and maybe even sometimes painful, then sometimes it gets, as you said, infected, then your ENT specialist may decide to have them remove them, yeah.
Okay.
Or if the produces stones frequent. Sometimes stones dislodge by themselves. Sometimes the stones are quite big. Then they cause trauma. It becomes very painful. Then you can have it. You can have them removed. But not everybody who has tonsils or tonsillitis would necessarily have bad breath.
Have bad breath.
Yeah.
Okay. And you have mentioned some of the, I believe these are just good practices, brushing, using a mouthwash after brushing. So do this help with bad breath? Like, would you maintain with that for a whole day?
Yeah. So I think generally, if one way if you feel like you have bad breath, I think you should go see a dentist, see the doctor, and then part of the things that they could do is they'll check your teeth in terms of your gum. The status of your gum, your periodontal health, and it can be optimized through cleaning, which is known as full mouth scaling and prophylaxis. Another thing, if you have any cavities or deep pits and fissures where it may be difficult, it's like valleys, you know, in your teeth where food may be hiding, and then bacteria may act on that food and eventually also decaying, then producing odor. Then that also can be done. Not only cleaning, but also fillings, and then beyond that also practicing good oral hygiene. You should be able to floss. Not only brushing, but also flossing, because sometimes there are some areas in between, those contact areas between your teeth, where sometimes, depending on the design of your toothbrush and even your own dexterity, it may be hard to reach. And so it is possible to get to those areas if you use dental floss. Coupled with the use of an antibacterial mouthwash, you should be able to have good breath. Some people also can advocate for maybe chewing sugarless, maybe mint gum, maybe if you...
Oh, the sugarless mint gums.
Mint gums, yeah, so that kind of thing. So it's up to you. Yeah, okay. The aspect up to the gum area, that's a bit optional. But generally, yeah, just regular cleaning by the dentist and personal oral hygiene, at least brush after meals.
All meals or morning and evening?
Some would say brush 2 to 3 times. Some other people I've met people who brush almost 5 times, but that's bordering on OCD.
That is a
yeah,
lot.
yeah, it's a lot of
to
time. And then
brush.
sometimes, if you're too aggressive, also sometimes you can cause trauma to your teeth, because some people use a lot of force, and some people also use very hard toothbrushes, because they feel like it's like scrubbing a sufuria, you know. It becomes shinier the more you do it, and the more thoroughly you do it, etc., etc. But ideally 2 to 3 times is okay, mostly after meals, in the morning after breakfast, and most especially in the evening before you go to sleep. Yes, you should be able to brush. Yes,
It's great that you've mentioned flossing, because in the morning my co-host was asking, for flossing, do we have to use the normal floss that we see, or is the old way, the traditional way they were, doing, is it still acceptable?
so I think you're referring to the sticks, the people used to chew. Some people still do it, by the way. It's not necessarily old. Some people still use it. It's called mswak. Call it mswak. I don't know. Mswak in Swahili, I think they sort of brought it into English and called it mswak, something like that. So it still works, as long as it's about how fine the bristles are. You know, it's usually somebody choose that piece of, and sometimes I've also realized it's a particular tree in some communities. So somebody chooses it and makes it really fine, and then just uses it. The same concept. It's only that now toothbrush is more commercial, and the bristles now you can have hard, soft, and medium. So it should also be, it should be able to work. But beyond that, we also have dental floss, which is that string, which you can be able now to go very in between those intimate contacts.
How often should you floss?
Flossing, I think, generally is you should be able to floss at least once a day. Then in the evening before you go to bed. I think it may be difficult for others to, but you should be able. After cleaning your teeth, you should also floss. Ideally, yes. It should be a good practice.
It's a practice that we should.
Yes.
About the toothbrush, you have rightfully mentioned that the different kind of the hard, the soft, I think the medium. Which one is most recommendable? And now I've even seen those electric toothbrushes. So which one is highly recommended?
So when it comes to toothbrushes, as I said, the spectrum is there for you. There are those who go traditional, there are those who reject Western ideologies, and so they stick with what nature produces themselves. Then in the arena of modern day toothbrushes, then the texture of the bristles is different, and then even the sizes of the head are different. And so when you're selecting a toothbrush, I think generally a dentist can also help if you're having difficulty. But then normally most of the toothbrushes that we buy are medium. The bristles are medium in terms of texture. But now it depends with there are many how effective it is. It depends on how you use it. You can have something really nice, but if you don't have the know-how how to use it, then it becomes useless. So beyond the toothbrush itself, sometimes there are aspects like the technique which you're using to brush, and also the force that you're using to brush. Some people who use a lot of force
when brushing.
So, when brushing. So for example, you will notice people who are right-handed tend to, because it's easier to brush on your left. So you find most of the teeth on their left, if they're using a lot of force, are worn off, especially where towards the gum where the enamel is a bit thin. So if you use a medium brush and then you're using a lot of force and then you're brushing back and forth, you're just going back and forth horizontally, sweeping like that, then there's a possibility that over time you create, through friction, you create grooves within your teeth, and then eventually you have sensitivity. So for such people, then you would advise them, because sometimes force is something that's none of us knows. We can't really quantify in terms of physics that, this is how much newtons of force I'm applying. Sometimes it's very subconscious. And so for them, you tell them to just change the technique, and also beyond changing the technique, also to buy a soft toothbrush. That way, even if you use a lot of force, the effect is, the damage in the teeth is very minimal. So it depends on the person's practice, how they brush their teeth.
Okay.
Yeah.
And I'd want you to demonstrate for us now that you have carried a dummy and the toothbrush, so that those who are not very conversant or do not know the right way of brushing would actually know. So I'd want the camera to really focus on this dummy. But before even they get to that, as you show us, is there a specific, not to mention brands, but are there specific toothpaste that are good for our oral hygiene that we should look out for, like maybe the amount of fluoride, that kind of a thing?
All right. So when it comes to toothpastes, then it's kind of a whole debate. I'm not particularly sponsored by any manufacturer, therefore I cannot really, promote a particular brand. However, I could say I think fluoridated toothpastes have their place. There are those I know who a bit health conscious and say fluoride. There's a lot of fluoride everywhere. You know, there's fluoride in water, there's fluoride in toothpaste, there's fluoride in tea, and so there are people who advocate for non-fluoridated toothpaste, and those are also there in the market. And so it just depends with your world view, what you're looking at. But generally, the science towards adding fluoride in toothpaste is valid, and fluoride actually helps to remineralize and strengthen the teeth. And so, and it also has some antibacterial properties, and so fluoride is good as long as you don't ingest it. And so the only place where don't swallow.
Okay, because I know kids swallow.
Yeah. So for that reason, we have different brands of toothpaste for kids. If you go to the supermarket, you'd find different manufacturers will tell you this toothpaste is for kids between 2 years, 2 to 5, because now what they've done is they've reduced the amount of fluoride. Some are even there are other brands in the market which are completely don't have fluoride. Yeah. So that's what I would say. And then there are toothpastes which are specifically targeting people who are having sensitivity. For example, a common brand is like Sensodyne. I think if you've heard of Sensodyne, Repair and Protect, Rapid Relief. Then there's also another brand called Sensodent KF. Then there's also Colgate also has some brands for sensitive teeth. So those are for those people who have sensitivity. Sensitivity is when you take something hot or cold and then you feel a sharp electric pain, you know, and then you almost freeze. Then there are some toothpastes or dentifrices that you can be able to use.
But this is different when you have like a very cold ice and you feel like you have a brain freeze. That's different.
That's different. Yes.
So this is when you're very sensitive to either hot or cold drinks.
Yeah. It's in relation to dentine. There's dentine. The tooth has got like the surface of the earth, you know, the way you say there's a core, there's a mantle and everything. The tooth is equally layered. So the topmost surface of the tooth is enamel. Then the enamel, under the enamel there's dentine. Then from the dentine you go into the pulp chamber. The pulp chamber is where we have blood vessels and nerves. Then some of these nerves now, through very tiny holes, it's called dentine tubules, have tiny holes within the dentine. So when you expose the dentines, you sort of expose some of these tiny nerve endings. Therefore, when you take something hot or cold, the nerve, you feel that pain. It's transmitted to the nerve. So what some of these toothpastes for sensitivity do is there's something called hydroxyapatite, and they have many other things, some strontium, some chemicals. There's some science there. So what they do is, in essence, they block those dentine tubules, and therefore they prevent if you take something cold, foods or fluids, when they come into contact with the tooth, you find that the dentine tubules are blocked, and therefore you don't have that sensitivity. So that could be in part be caused by, sensitivity could be caused by some people who take very acidic things. For example, there are people who take a lot of lemon, some people who take a lot of soda, a lot of soda like Coke, you know, and then you don't brush your teeth. And people who take like, I met somebody who literally ate lemons like apples.
Wow.
And you could see the way the damage is done. Yes, on his
acid
teeth.
affects the
acid.
teeth.
Same way the tooth decays. It's because of the food, the sweets, and then now that's like it becomes a substrate for the bacteria. The bacteria breaks it down, and then as a byproduct, acid is produced. And then it's this acid that breaks down your tooth. Then eventually you have a cavity. Then you have one of the symptoms that you may be having a cavity is what? Sensitivity.
Okay.
Yeah, so those are those aspects. So there are some toothpastes for that. And then, so when it comes to fluoride, fluoride has been proven to help prevent cavities and by remineralizing and strengthening the tooth. But if you are of the mindset that you don't like, there's enough fluoride in your environment, then there are other non-fluoridated
Other
toothpastes which you can use,
you.
which are equally effective, yes.
Okay, so show us, give us the demonstration how we should brush our teeth before we continue.
All right,
the
so
discussion.
I think first of all you should consider how wide you can open your mouth. I think that's an important aspect, because you realize for most people, decay starts, statistics have shown, almost 90% of decay starts with the back teeth, the molars. And most of the time it's because somebody is using a toothbrush with a large head and the mouth opening is small. As you can see in this demo, you see the mouth opening decreases as you go. It's like a V. So there's less space to manipulate
At the very
at the very back. Yeah. So sometimes you find some people sort of unbeknowingly neglect the last teeth, especially the second and the third molars. Sometimes even the first molars are not really cleaned effectively. So I think when you're selecting a toothbrush, you should also consider how wide you can open your mouth, okay? And therefore choose one with a head that's significant enough for you to be able to get to the back. And as a good rule, sometimes some people, they say there are many ways to skin a cat. I don't know why you're skinning the cat, but nonetheless, the thinking is that there are many ways of doing something, almost like the end justifies the means. Not always a true thing to live by, but nonetheless, some people believe you should begin with the back teeth, okay?
Okay.
Begin with the back teeth, and then you go in uniform circular motions. Uniform circular motions, and then when you're looking at the bottom, when you're working with the bottom, then also angulate a bit, because there's some space, there's a sleeve of space between where your tooth is emerging from the bone and where it's coming into contact with the gum. So sometimes food is like a pocket there. Food can be able to be trapped there. So you need to also angulate a bit into that area and be able to clear that food out. And then you go uniform circular motions, uniform circular motions, uniform circular motions. Same thing, beginning from the back. Make sure if you have a tooth at the back, make sure all teeth are touched. And so eventually you can then move to the occlusal surface, which is the top surface, the biting surface. And then also remember to do the same on the inside, the lingual surface, the surface where there's the tongue. So equally clean on the inside like that. And then do the same on the upper, but then also slightly angulate to enter into the gum a bit and clean in that sleeve, that space that you've said. And sometimes food, material elbow plaque may be able to be trapped there. And then uniform circular motions are ideal because you're distributing the force, as opposed to continuous horizontal brushing, which sometimes stresses one particular region of the tooth more than the other, and then that area which is has a lot of force, frequently the enamel starts wearing out, and then eventually you find you've created a groove and the dentine is exposed, and then you have sensitivity. So uniform circular motions, uniform circular motions. At the front you can go uniform circular motions, or you can go up and down. Up and down, it's possible, it's also allowed. Yeah, and then just ensure you clean the inside also, and the occlusal surface, and lastly also the tongue. Sometimes bad breath comes from the tongue, you know, because you've cleaned everything else, but you didn't clean your tongue. And sometimes there's plaque there. Same way when you eat mabuyu or baobab, you see some of it sticks on the tongue. Similarly, food particles also stick on the tongue, as well as odors. So cleaning the tongue is equally effective. Same thing can be done with for those who fancy electric toothbrushes. They can do almost the same. Different electric toothbrushes have different settings, how they oscillate, and then also those people who are in one way challenged, maybe disabled in one way or another, or differently abled. I don't know what the political, yes, adequately abled.
Okay.
Yeah, so even those people then, they can use electric toothbrushes, and they'll be effective for them.
So how does the electric toothbrush work? Did you just put it in your mouth and it just does the work for you?
So yeah, so for example, let's say somebody who's maybe you're recovering from like a stroke or something, so you're still learning how to take care of yourself, or maybe a caregiver is taking care of somebody, like even in hospitals. I think right now, even people like in ICU, you know, people who are in vents, they're not awake, maybe even people in comas, etc., they still deserve to have a good oral hygiene, you know, and so for such people, then a caregiver can use an electric toothbrush to just clean their teeth. Yeah, so even like persons living with disabilities, they can be able to use them. Though there are people who are equally healthy who still use them, which is also okay. Yeah, and so the settings are different. Some there's a way you can set like how they oscillate, how it vibrates.
And is it safe to use?
Yeah, it is safe. It just depends on how you use it. Yes, it should be. There are no challenges there about it. If you can afford, why not?
Why not? I mean, technology is here to make things easier for us at the end of the day. So that's how we're supposed to brush our teeth. Circular motions, start right from the back of the teeth, and then when you're buying a brush, make sure you consider how wide you can open your mouth.
Reach, yes, how far it can reach.
How far it can go. Yeah. So if you can, then get the smaller one.
A smaller one will be much better, yeah. Okay. Otherwise, you'll be saying goodbye to some of the teeth at your back. At the back. Yeah. Then also in terms of time, also you shouldn't be in a hurry. For adults, around 3 to 6 minutes. Wow. Is good time to brush your teeth.
I don't know how long you take to brush your teeth, but now you know 3 to 6 minutes for adults. All right, now let's talk about cavity, because some people, I had cavity when I was really small, and mine was black, you know, and especially molars. Most of my molars were the ones which were removed, molars and premolars, and now. Is that because of because I took a lot of sweets. I'm a sweet tooth. So that caused it. Could that have been the reason that caused it? And is it the treatment always just to get the teeth or tooth out?
All right. So what you're referring to is dental decay, tooth decay, or
the term different.
It's the same thing. I think it's the same thing. How it looks like. Sometimes the terminology that they use is dental caries, and so caries can be active caries. It looks different. Sometimes it's yellow, and then you can actually fleck it off. And then sometimes we have what is called arrested caries, where there was decay and then it suddenly stopped. Okay, for one reason or another. Maybe you started using a fluoridated toothpaste. Maybe you reduced your consumption of sugary foods. So for caries to occur, there are multiple things. There are multiple things that happen. For example, we'd ask ourselves, in the times in which we are living, there's a lot of dental decay. But if you go back like a few years, 20, 30, 40 years back, our grandfathers would die with full sets of teeth, you know, in the mouth. Yeah. So you realize there are certain aspects of, for example, processed carbohydrates. You know, diet is an aspect of it. Sometimes also the morphology, the way your tooth looks like. So if it has deep pits and fissures, so there are some areas which are like it's so deep, it's very difficult to clean, you know. So that can also be something that can predispose that tooth to tooth decay. And so, but for decay to be there must be a substrate, which is this sometimes highly refined carbohydrates. Such as examples you say, sweets and biscuits and chocolates. Then if you don't clean, and then they stay there, and then also bacteria. Okay, so bacteria comes and acts on it, and then eventually now you start having decay. If decay goes on long enough, it wears off the outer layer that is the hard layer, which is enamel, and then it goes into now, it demineralizes the enamel, the acid, and then we get now to the dentine. Now when you get to the dentine, now you start having sensitivity. Now, then sometimes some people ignore that, and then it continues. Now you get, the hole becomes bigger. and then eventually it gets to the pulp. Now when you get to the pulp, that's when you have pain. And for most of us, unfortunately, our health-seeking behaviors are because of pain. Pain is a motivator for us to go to hospital, which shouldn't be so. Ideally, you should be able to see the dentist twice a year, once every 6 months. Go for a checkup, and if you're really, really good, then at least make it once a year. But ideally, once every 6 months. For people who are have other issues, then perhaps for one reason or another, the dentist would ask you to come once every 3 months, etc., etc. And so for decay to happen, there are multiple factors. Ideally, if you go early, then just a feeling is enough. But by the time you're having pain and you can't sleep, and then you're the first person even at the door of the hospital waiting for the dentist to arrive, then most people usually say, just remove it, you know. But it is possible to save the tooth. Usually we try to save before you condemn something. And so depending on the status of the tooth, how much of the tooth is still left, then you can be able to do something that's called root canal treatment, in which basically they go into the pulp chamber of the tooth, and then they remove the blood vessels and the nerves, they clean, and then they seal it. So the tooth is quote unquote dead, but it's still present in the mouth.
Okay.
Yes.
So that's what root canal
That's
actually
what root canal is, yes. After that, then you may not, or you may require a crown, just simply to secure the longevity of that tooth. A crown is where they prepare like an artificial cap for the tooth, either made of metal, or sometimes it can be made of porcelain or other materials that are tooth colored.
And would you need to be regularly replacing that crown?
No. If a crown is a well done crown sitting on a good tooth with where work has been done very well, should be able to stay with you for even 20 to 30 years.
Okay, that's good time. What do people do? Because I think, I don't know if there's a pain that surpasses the pain of a toothache, and especially at night, because you've said people do not sleep. Is there a thing that a remedy for this pain before they get to do a root canal? And what causes the pain? Is it just the decay? Could it be something else? And what are some of the temporary solutions that people can actually apply?
All right, so the pain, as I said, is usually begins as sensitivity, where a bit of these nerve endings are exposed in the dentinal tubules. But eventually now, when you get to the pulp chamber, now we have a lot of blood vessels and nerves. And then now, when the nerve is exposed itself and you touch the nerve, then there'll be pain. Beyond that, there's bacteria there. And so there's also aspects of inflammation and infection. Okay? Sometimes untreated tooth decay eventually develops into an abscess. You've seen some people even have pus coming out. Then if it continues even further, sometimes some of this pus, there are some spaces between the tissues in the mouth. The pus can spread, and eventually you find somebody is really swollen. Then if it continues even further, it can even go down here and even lift the flow of it can lift the flow of the mouth and the tongue. Then this pus can even have a difficulty in breathing. And then there are conditions like Ludwig's angina, which are medical or dental emergencies, where somebody can actually die. So tooth teeth are not to be trivialized that much. And so usually, if you have any sensitivity, I think before it becomes painful, it is advisable to go and see the dentist and have something done. If you require a root canal, have it done. For pain, usually just as a stopgap measure, maybe at night, you can get go to your closest pharmacy and get a painkiller. Really nice painkiller should be able to give you some relief, and then in the morning seek medical dental treatment.
Okay, because I've seen people use some really interesting things.
There are a number of things. I think there's one that's common. It's called touch and go. I think that one. But that also sometimes is it can burn the tissues. It can be very caustic. Yeah, the one that I've seen sometimes that helps a bit. I've had some people do what is called oil pulling. They put some cloves and some coconut oil, and then it sort of like calms the nerve, soothes the nerve. But those are stopgap measures. Ultimately, you need to go and
get a permanent solution.
Go see the dentist. Yeah.
Okay, interesting. And now to talk about you said foods, foods influence the kind of teeth we have, and that's why some older generations still had teeth.
In terms
all
of their
them.
diet,
Yeah,
the
in
diets
terms-
of our forefathers, for example, they still ate sugarcane, but see, fiber also helps sometimes because
Sure.
not only is there sugar, but also the fiber itself cleanses the teeth. So but in the era where we're eating very refined sugars, very refined carbs, and we don't brush that much sometimes. If you don't practice good oral hygiene, then you become susceptible to developing dental caries. Yes.
Okay, so good diet, good fiber is good for the teeth.
A good diet, but also you can actually, to a certain extent, you can get away with a lot if you practice good oral hygiene. Yes,
Okay.
you can get away with a lot.
That's
You
consoling.
can, but the other, you may have good teeth, but you may predispose yourself to other things like diabetes. Those ones, toothbrushing may not necessarily
So you can't
help
really
you.
escape that.
Yeah, so there are aspects. Generally, I think the more wholesome our diet is, the better for us. And I'm always an advocate for that. But for sometimes, when you're children, even I myself we like the sweet things. We like good things. Even sometimes when you're adults, also, some of us, our comfort foods are when you're having a difficult time. You look for some something sweet.
Yeah.
Maybe it takes you to your childhood times. I don't know. But yeah, always remember to brush your teeth. Yes.
Regularly.
Yeah.
All right. Now I want to talk about the discoloration of teeth. Brought about by salty water. I think it's the amount of fluoride.
Fluoride, yes.
Fluoride
Yes.
in the water. So touch on this a bit and how that can be cured.
All right, so what you're referring to is called dental fluorosis. Fluorosis is defined, it comes about, manifests as discoloration of the teeth. It affects the hard tissues, high levels of fluoride. I think the WHO says it's around 1.5 milligrams per liter. Okay, that's acceptable. Beyond levels above that, then
Above 1.5
milligrams per liter, if my memory serves me right. Above that, then we have it's considered a high level. Some people would like it to be even lower than that. Fluoride is there in the environment, in the rocks, and so sometimes, especially if you in Nairobi, sometimes the way people have developed so much, people build apartments, and then of course there's a problem. The city council cannot supply everybody with water.
Yeah.
So what these developers do is they sink boreholes.
Exactly.
Yeah, but unfortunately, sometimes when you sink a borehole, ideally you're supposed to take some of that water to be tested. Supposed to take the water to be tested. There are many other there are organizations, there are places. I think even the government chemist can take a sample of your water and give you whether that water is even safe. You can find sometimes it has some other trace elements which may not be safe for human consumption. So anywhere there's a borehole, you should always take that water for testing. Okay, so with that, then if the water levels are found to have high fluoride, then there are other measures that can be done. You can buy there at-home filters, water defluoridation systems, which you can buy and install. So for the water that you consume, it's not only water that you drink, but also the water that you cook with. That also goes into your system. And what you see in the teeth actually also happens in the bones. Like it's all hard tissues, so it's not only dental but also skeletal. So it's an issue that I think maybe requires a conversation at both county levels and also at national levels, because now it's affecting not only the dental but also skeletal. But we see it in the dental, and it manifests differently. Sometimes if you have what is known as mild fluorosis, you find like white spots on your tooth. Yeah,
exactly,
okay.
And I was telling my co-host, because nowadays you'll see the children in Nairobi, something that was not there before. They have the spots, the teeth are not as white as, the older generation.
Yeah. And also sometimes there are some areas where there's like sort of a lot of fluoride in the water. For example, you can almost sometimes people joke, you can tell somebody who's from Nakuru, you know, or from Naivasha,
You know, yeah.
especially if they grew up there as children, by the color of their teeth, especially if they took the water in that particular region. And so even sometimes nowadays, I think even some people from Rongai and other areas, even Kawangware, sometimes you see, as long as you find they're taking borehole water, like people have built apartments or residentials, and then they're getting borehole water that has not been treated. So studies have shown that there's a link. Some studies, some people call them, they think of them as being controversial, but there's some correlation has been made between IQ and dental fluorosis.
Really?
Yes.
Okay.
And I think also sometimes, to a certain extent, maybe you can extrapolate and say some of the, you know, the way children are. Children are very brutal. If you even have like a swelling or something, children will laugh at you. Children are very harsh with one another, and so that can be a bit difficult for children, and so it can also affect them in terms of social engagement, their social development, which may also affect them academically, you know. And so those are aspects of fluorosis that need to be addressed. So prevention, I think, if you are taking water from a borehole, even sometimes even some of this water that we buy from some of these really fancy companies, you know, sometimes people say, I'm drinking water from my dispenser is from so and so. Yeah, just sometimes just check the fluoride levels, and even some of these water dispensing points that pop up in our estates. Yeah. So that could also be a cause of that. And then even tea. The soil where tea grows is usually very acidic, and so also. And then the fact that you boil the water does not help. In fact, boiling concentrates because now some of the water is evaporating. Now it's concentrating more of the fluoride.
It's only kill the germs, but the fluoride
fluoride will still be there. Yeah. So prevention is important. So it's as much as possible. Usually, I say, if you can't buy water, try and get to an apartment or an area where that is served by county council water, but that also is rationed sometimes. Then beyond that, then if you have a place where you have borehole water, then you can buy at home filter system. They're there.
And you can get that, you can install that easily by yourself? Yeah,
you can install that easily. Sometimes even the people who sell these things, there are some dentists who are doing that. They can literally come to your house and they fix, and they offer after sale services support. So you can fix it on that particular tap that you use for water for drinking and cooking. Yes. And then the rest of the water you can use for showering and washing. The other aspect is to be aware of the water where your children are growing, especially if you have young kids who have teeth where the teeth are still developing. Yes, because the fluorosis affects the teeth as they develop. So by the time they erupt, then depending on the amount of fluoride that they were exposed to, then the spectrum is different. So you can find some have white spots, some have a bit of brown, and then some is like really terrible, just really brown, and then it affects their esteem. However, it is possible to treat dental fluorosis. You can be able to have masking done, or you can have, as you said, crowns. Crowns can be made, or veneers, depending on the extent.
Level.
Yes, on the extent and what modality of treatment your clinician views and feels is good for a particular case.
Okay, great. Thank you for that. There's a lot I'd like to ask, but because time is not on our side, I'd want you to share maybe the last tips that you want to give, maybe a summary from everything that you've spoken, as you also tell people how they can reach you if they have any condition that they'd want to consult you on.
Oh, all right.
That is your camera.
That's my camera. All right. So I think I would like to speak about maybe an issue that's emerging, especially in our country today. I think seeking qualified healthcare is important. So in the city today, we have many people mushrooming, all of them claiming to be dentists in one way or another. I think we need to be vigilant about that, because sometimes I've seen people come with work that has been done to them, which you ask, where did you go? And then they tell you, oh, there's somebody who who was offering some service for 500 shillings, you know, etc. Sometimes cheap can be expensive. And if you really want cheap, then I always encourage somebody to go to a government facility. You know, go to a government facility. There's the University of Nairobi, there's Kenyatta National Hospital, there's Mbagathi. There are many other facilities that are within your reach, and there I'm sure you will find personnel that can be able to treat you. Because sometimes not everybody who has a white coat is a doctor. Even butchers wear white coats, you know. Yeah, so I think that's there are issues there in terms of regulation and scopes of practice. But I hope those things will be settled. But it is, I think, in Kenya, as a patient, you need to be a bit more proactive and inquire where you're going. You know, who is this? Who's treating me? Try and today we have on the website for the board, you can actually go there and search and check and see if such and such a person is actually a dentist, a practitioner, a qualified doctor. So I think that's an aspect that we should be able to embrace in our health-seeking behaviors. Beyond that, also, let's not wait for pain to be able to go to hospital. You know, so if we find somebody is in pain, that's where they come with their whole village, and they demand immediate attention. Whereas these things that could have been cheaper if you had presented earlier. Okay. So the longer you wait, the higher the costs. So yeah, currently I work at a hospital in Westlands. It's called Jalaram Medical Center. It's opposite the Oval. You're free to come in anytime for consultations and for treatment.
Okay, great. Yeah. Do you want to share your socials?
I'm not really very social.
Okay.
I'm not very active on Twitter or any other place. Yeah, so yeah.
That's fair enough.
Yeah.
Thank you very much for coming on board and sharing such amazing insights on oral hygiene. When we want to expound, we hope that you'll be here for another discussion.
Definitely. All right.
Great. So that has been Dr. Raphael Onsongo. He is a dentist and a resident in oral and maxillofacial surgery. Yes, if I've gotten that right, and we've been talking about oral hygiene, I hope you've gotten something from that. Here's where we take a break, and then Val will be coming up with yet another insightful conversation. Stick with us.